Hello everyone, good afternoon and welcome to Savvy Central Radio. Each week we host new individuals and business owners to share their expertise, dreams, and lessons learned in their field of business. Our guest today is Wayne Kelly, President and CEO of HCXperience Inc. HCXperience Inc., the next generation of patient satisfaction experience survey data collection. Their motivation is to provide real-time data that will offer healthcare providers the opportunity to improve patient care when data is relevant and now. HCXP believes that by providing an irresistible product that focuses on improving the overall healthcare experience for one irresistible same price for all healthcare facilities, together we can build a very reliable comparison database that will offer real-time comparison benchmark reporting across the entire healthcare continuum. To find out more information about HCXperience Inc., you can go to their website at www.hcxpinc.com or call them at 717-439-0314. Hi, Wayne. Thanks for coming to Savvy Central Radio today. How are you?
I'm doing great, Christina. How are you?
I'm doing awesome. I'm so excited to have you on. I'd love for you to tell me about your experience and how you started HCXperience Inc. and how it all came to be. You have a fascinating story and a journey. I'd love if you could share it with our audience.
Thank you, Christina. In 2000, I started with this very small company, Healthcare Data Incorporated. We grew to be a large company, the largest Joint Commission submission vendor for long-term acute care hospitals in the nation, as well as holding the Department of Defense contract for core measure submission to CMS. Then in 2006, we were purchased by big corporate, United States of America, and everything started falling apart. Unfortunately, for myself and my clients, things started falling apart. With a very small company, you grow with your clients. You gain that relationship and that mutual respect. Mm-hmm. Then when we were purchased by Big Corp, they split our company in half and fired everybody but me. I was left there to run the company, do everything needed, training everybody internally, training all the outsourced employees that my jobs from my previous coworkers went to, training the project manager, which was a joy to manage the products that I brought over. And needless to say, 6 years later, 2012, my blood pressure shot through the roof. I had a minor stroke, and I didn't return to that job. It was at that time I decided to go with my vision. For about 7 years, I sat on this vision of real-time patient experience data, real-time healthcare experience information available to our beloved healthcare community. So it was at that time, last March, a year ago, and it's amazing, honestly, Christina, that I was able to put something like this together in less than a year. So last March, I believe it was the 27th, I left that company and was fortunate to run into an old friend who was recently laid off from AT&T as an engineer. We ran into each other at Starbucks and I ran my idea by him and he didn't have anything going. So here we are today with a product ready to hit the industry and change the world by offering real-time patient experience data.
What I'm really struck with there is how important it is to not have your company based on dollar-driven bottom line idea. And you found out there working in the big corporation, I'm not able to serve my clients, I'm beating up my health, destroying myself, and I can go out and do it better and deliver client experience data to caregivers and help patients get the message out to their doctors. It's not working. Here's what you can improve. Yeah, so it's great that you were able to do that.
It's fun to think about the possibilities with this thing where in our current industry, I know everybody is familiar with our current industry. We all get those paper surveys, Christina, when we visit a clinic or our doctor, but the problem is those surveys come 2 weeks later. I don't even remember who I spoke to that day, but they want us to remember everything about our visit with that doctor. It was, our communication with the doctor, our communication with nurses, medications, this and so on and so on. But where is the connection with the patient when we receive that in the mail? Where is connection with the the caregiver, the organization entirely. With our product, the patient is approached at the point of care with a tablet, and we ask them sincerely, or I suggest is quality department or a volunteer or someone of that nature. Or even at the clinic, these tablets can be put on a pedestal, and you ask the patient, please take the time to fill out this survey so that we can improve our care that we provide to you. And I can tell you, if I was presented it in that manner, I would fill out the survey. I get that survey in the mail 2 weeks later. I'm the CEO of this company. I've never filled one of those paper surveys out because I know what takes place on the back end and how irrelevant that data is by the time the reports are returned to the caregiver. There's really nothing you can do with the data provided in reference to improving the patient care or the patient experience.
Mhm. No, I agree. And I can totally relate. But this past August, I had a horrible experience at a hospital. And I don't recall getting one of those surveys, but in the past, when I have, I just dump it because I don't see how it's going to end up fixing anything at the hospital or doctor's office. So I just never even bother. But if they were to give it to me while I was there after I finished out my normal paperwork or whatever, and I've just had a not so good experience or otherwise, and I can actually tell them about it right there,
Yes,
it makes me feel like I'm being heard.
exactly. And let's face it, not only just as a healthcare consumer or patient, but as an individual, that's all we all really want, to think that we've been heard.
Exactly.
And too often in the medical profession, the patient feels inadequate.
Hmm.
They aren't being heard, or their concerns aren't heard. This application gives our patients the opportunity to voice their concerns and in a manner that it will be heard. But not only heard, reports are prepared and available as soon as the data is completed, which is really unheard of in the healthcare industry as far as surveys are concerned. Like I said, currently, it's mandated to our short stay hospitals that they must do this survey. It's referred to as HCAP survey, but it can only be done in paper and IVR. And historically, let me go back for a second. In early 2000, when we first started, early 2000s, probably 2002, when we started patient satisfaction, it was our motivation and our goal was to improve patient care, provide data that will allow the healthcare provider, the caregiver, to improve patient care. In 2006, maybe 2005, when industry got wind of this, and not only that, but the aforementioned CMS, they got wind of it. They decided that it's time to mandate this, and it's at that point they created the HCAP survey, which is now a mandate for our short stay hospitals, to the tune of only 32% return. I believe this year it was a 32% return rate, maybe 33%. So if we take that into consideration, and this gives me a segue to talk about the green aspect of our application, if you don't mind.
Mm-hmm. Go for it.
Like I said, in 2006, when that was mandated, it seems to me, because I lived it, I was there, HCD was a beta test site for HCAPs. The focus was then turned from only patient care. Let's provide this data to improve patient care. But now the focus is we have to make these mandates or we're going to get dinged. And now, Christina, currently, as I believe this past year, 2013, the mandated survey, HCAP survey, is now part of, I believe, value-based purchasing, which is huge in healthcare at the moment. But now, according to the scores from the HCAP survey, the mandated survey for short stay hospitals, they will get reimbursed up to 30% based on that information. So the problem here is, and I wrote a little blog, everybody's welcome to read it. I think you can link to it from our webpage, HCXperinc.com. I wrote a little blog called The Elephant in the Room and touch base on this because the elephant in the room is our mandated surveys. The bottom line is 32% return doesn't give me anything I can measure from. There's not another industry in our globe, our country, that they would take 32% of a whole picture and base any type of adequate information from. I don't understand how we can continue to overlook the real problem with this industry, and that's the paper and IVR, the untimely reports, and the huge margin of error from patient pen to paper to the time that survey is mailed back, snail mailed back. The paper survey is then scanned. But not only that, one thing that is also failed to mention during this whole process is that there is human intervention that actually looks at these surveys. If there's any X or any, for example, when somebody fills out the survey, if the little box isn't filled in, human intervention will then decide, okay, is that X closest to this box or that box? And then they'll make that correction at the vendor or hospital level. So the margin for error is huge. With a service or a solution like ours, the margin for error is only from patient fingertip to entry on the tablet with immediate feedback results. So as far as the green aspect is concerned, let's look at the 32% return. And this is where it gets really fun. Okay, so the most recent available public data with this mandated survey available today is from the time frame July 2010 to June 2011. And here we are in 2013. During that time frame, there were 3,850 hospitals that participated. 2,786,000 surveys were received or completed. But like I said, that sounds great, but let's take into account that 33% return. 33% return, if that's our return, 2.8 million surveys, then that would indicate to me that 8.4 million were sent with a waste of nearly 6 million surveys with a minimum. And I did this estimate. I'm a real stats guy. Obviously, you can. Needless to say, I have great success with fantasy teams. So what I've done is I've done this very simple yet very, I think, very kind estimate for our healthcare industry, and at 5,573,000 surveys wasted, with a very minimum estimate of 3 pieces of paper with each sent, that comes to about 33,000 reams of paper, or 3,400 cases, 83 pallets of paper, very kindly priced at $1,700 a pallet. You know, these hospitals aren't buying their paper by the pallet. That comes to about $141,000 of paper waste a year with our current paper survey industry in healthcare. And like I said, that's a very kind estimate. Let's take into consideration the envelopes, the postage. And Christina, one thing that you may not, or our consumers don't understand, is I believe they make attempt to get these surveys filled out 5 times.
That's nuts. Absolutely.
It's crazy. So if and when CMS decides, or our nation decides, that digital submission of this type of data is acceptable, that's the type of waste we can remove from healthcare, and we can give back to the places in healthcare that dollar can be spent, more effectively.
And I know from speaking to a lot of my past business owners and clients that it is something that's very important to our society right now, is being environmentally friendly and green. So everyone in the public, if you don't want to see more wasted paper, talk to your hospitals and doctors about getting Wayne serviced here at HCXperience Inc. It's very important. And you know what I really liked what you mentioned is that when it's mandated and doctors feel I must get this HCAP survey out there, it's more about having to fulfill laws than really trying to please patients.
Exactly.
And it would be nice for doctors to not have to be overstressed with now insurance paperwork they have to put through and surveys and this and that, and I have to be in compliance. One more issue to think about. This would just relieve a little bit more stress and allow the doctors to spend more time with patients.
Exactly. And again, let's go back to the reason we all got into healthcare is to help patients. And it's really disgusting sometimes that is so far removed from our vision at this point because of the smokescreen that is put in front of all of us with mandates, paperwork, and all that nonsense that you mentioned. So that's our desire. We created a great product. Our motivation, our sole motivation is to improve patient care. I hope to be able to be a vendor for CMS and a Joint Commission, or who's some of the other one, DNV, Det Norske Veritas, I believe, is another vendor for quality improvement. I hope to one day reach vendor status, but these folks have to first come to terms with this is the right thing to do. Our current industry, Christina, I mean, my goodness, by the time the survey is reached by the patient if they decide to fill it out, and like I said earlier, most of us, at the tune of 63 or 64% of us, take those surveys and throw it in the circular file in the corner.
Mm-hmm. Exactly.
So at point of care, we can provide a tablet-based application, or I'm sorry, it's a cloud-based application. It can function on any device. This is another thing, and might raise some eyebrows, but we designed this for the cloud. I'm not sure why entrepreneurs and designers are designing anymore for Android or iOS when cloud connectivity is so readily available. I believe the platform argument is nearly over, but that's another discussion.
Yeah.
So
tell us, the audience, in case they're not familiar with what cloud means, and some doctors might not be so tech savvy. So how exactly does the HCX reporting system work for them? If they wanted to get it in their office tomorrow and start using it, how would they go about doing that? Can you tell them a little bit about that?
Oh, sure, absolutely. Basically, referring to the cloud is just a fancy word for the internet. That's what's also funny, Christina. We've been doing EMRs and data processing and patient demographics submission and electronic data collection for years. Like I said, since the early 2000s. Now they have this fancy new term called cloud that they're using for internet. Patient satisfaction is referred to as patient experience. And, so when they rename these things, it's nothing new. It's just a rebrand or rename. So when you think consumers out there, when you think of the cloud, it's really something that's been around.
Mm-hmm.
It's just a fancy new term for web-based applications. Basically, all you need is a Wi-Fi connection or an internet-enabled device, and you can access our application. We've tested it on all platforms. I think folks are going to be very pleased with this offering, and I believe, Christina, you and I shared this some time ago with you in one of our conversations. I have a philanthropist heart pulse, and I hope that my company remains that way. My motivation is to help people, patient first, clients, hospitals, doctors, and this program and my business plan will allow everybody involved to profit. So it's a very simple plan, but honestly, it's pretty beautiful the way I believe it will work out.
No, I'm loving it. I love it for the green factor. I love it for the fact that as a patient, I'll be heard. I was frustrated, as I said prior, going to the hospital in August and not really being taken care of very well. And there's repercussions for me to follow up and get that resolved next time I have to go to the hospital. I would like that their service be a little bit better next time.
That's right. And if they took the time to really care, and here again, I got to watch what I say because folks will be emailing me and get mad. Hey, I care. I'm a doctor. I've been doing this. That's not what I'm saying. What I'm saying is we are now so busy with all the crossing the T's and dotting the I's and everything that we have to do our job that we don't have the time to do the things that we desire to do. With this application, I believe it gives us some of that time back, but not only time, the money back as well. So with this application, you're servicing the patient, real-time data. Your patients are being heard. You as the caregiver are making improvements on the fly. You could, for example, let's say you are a clinic and you have this application at checkout. When patients are checking out, you may have serviced 150 patients that day. You have real-time feedback data from those patients at the end of that day.
Mm-hmm.
It's pretty amazing. For example, you might be able to determine, would be able to determine all my patients, 150 patients, how many felt that their wait in the waiting room was too long. Mm-hmm. And not only that, which of these patients were of what sex, what race, what age group. How can we care for this demographic in a greater way? So it's really pretty slick with what we've come up with, and I believe this will be my legacy.
Yes, I totally believe so as well. And, doctors out there who are struggling, it's not that they don't want to take care of patients, it's that they're tired, man.
That's right. That's right.
I mean, I talked to one doctor. He owns 2 practices, and he also works at a hospital, Beth Israel. He's a wonderful doctor, but he said, I am overrun. Most of my time is spent in paperwork and not dealing with patients. Mm-hmm. And by the time you get to patients, you're so tired and whatever, you can't give them your full undivided attention. So it would be great if all these doctors' offices could get in with your program and relieve some of that stress and devote it more to their patients, the whole reason why they went into medicine to begin with.
That's right. Isn't it a great concept? I'm an old hippie in my thinking or something, whatever you want to think, like I shared earlier. Fortunately for me, I have a great team that I've assembled. I was very fortunate because I've been in the industry so long. My entire team are colleagues of mine that I've worked with over the course of my 12 years, even to the some of which are quality managers currently in hospitals that believe in this product and want to be part of this movement in the right direction. So I have a team of about 9 folks right now, my entire C-suite. We have a couple CSRs already signed, a couple CSMs. We're already in 4 or 5 states. And by the time this show airs, we'll have launched.
Yeah, I'm really excited about that. And I'd love if you tell the audience a little bit about your client service managers and client service representatives and your referral program. Tell us a little bit of how that all works.
Great. I would love to, Christina. In fact, that's my motivation to build the most valuable. My motivation is to improve healthcare. I think we've established that.
Mm-hmm.
And we're going to improve healthcare by building the largest, most valuable real-time patient experience database our industry has ever seen. In doing this, and my plan to do this, is to offer CSM and CSR jobs across not only the nation, but the globe. So a CSM would be a client service manager, basically responsible for everything. You build your own clientele, you communicate with potential clients, you build that relationship from contract signing to implementation to support to retention. They're your clients. You're just a contracted CSR, basically limited by your own motivation. All CSRs make 20% right off the top. Many of my competitors have a price point where, okay, well, if you want this service, it's this much. If you want several more surveys, it's this much. Oh, okay, so you have 101 beds. Okay, well, that's another $1,000. But wait a second, you need French and Spanish. I'm going to have to increase your price $2 more $1,000. Mm-hmm. And that's how it is. It's disgusting what people get away with. And all of these cries about how healthcare is going broke, it's hogwash. My goodness, there's so much money on the back end in regard to all these applications and all the services and the mandates and the nonsense that doesn't have to take place. That's what disgusted me the most. And here I am getting off in another direction. I got to get back to CSR here in a second. But when big corporate America purchased us, and I'm sitting on these conference calls with 10 or 12 people a day, wasting money. I'm just, like I said, I'm a stats guy. I'm thinking, okay, well, I'm the lowest paid person on this call. There's 12 of us here. We've been on this call an hour. We talked about nothing except the meeting tomorrow. How much money did our company waste? So those are the kind of thoughts that go in my mind. So in my business plan, we removed all those levels of management. We have our C-suite officers. CSRs are their own bosses. We have a CQO at the corporate level that will keep our CSRs and CSMs accountable to their clients because it's all about client care. The focus on patient improvement and client care. It's all about customer service. What I desire to do is remove that call center aspect. We're going to get back to one-on-one relationships, the trust factor. And in doing this by regional CSMs and CSRs, we will have that one-on-one. We'll build those relationships. The retention will remain and our prices will stay low because we don't have those levels of management and the huge overhead. Every one of our partners are mobile offices. We have no physical office. That's another thing. So as we continue to grow through 2013, I'm looking for CSRs, CSMs. CSRs are simple client service representatives. They're sales folks. They sell the contract. They make 10%. They know they don't have to do anything after that. Our corporate CSM will then take care of those clients, retention, and so on. The CSR will continue to gain that 10% for the life of the contract, even though all they had to do is close the account. Another thing that I've implemented, and this is really cool, like I said, I had a lot of time to think about this over the course of those 6 years that I hated working for a place that disgusted me. But like I said, I have a one price structure. All of my competitors want to build and build and build the price point. I have one price point fits all of $2,500. So my CSRs and CSMs know what they are able to make. And like I said, everybody is only limited by their own motivation. The upcoming years, we're all going to be able to purchase our own health care. So our motivation can be dollar driven as individuals, but not for the purpose or the taking away the care of our clients. So CSMs and CSRs can build their own income and be working out of the house with their family, or I mean, wherever their sidearm is, that's where their office. Me as a family man, and that's what I desire the most.
Mm-hmm.
Time is so short. It's something that can't be wasted. Now, and I think one of the questions you sent to me was advice or last words to your listeners, and I know we didn't get to that yet, but and folks will make fun of me for this maybe, but and you might not, but I mean, because we're probably about the same age, but I'm a big Bruce Lee fan, not only for his martial arts, but also his writings. And those of you out there, if you're in business and you haven't read any of his teachings, read Bruce Lee, see what you get from it. One of his lines is this, and this is really what got me going. If you love life, don't waste time, for time is what life is made of. So there I was for 12 years sitting in a company, or 6 years, that I couldn't stand, doing something that I didn't believe in, and I knew that I had an idea that could change healthcare. It's unfortunate that it came to high blood pressure and a minor stroke that gave me the motivation to move on it. If you have that idea and you know that it's something that needs to be out there, you got to just do it. So, Christina, what I did at that point is I took out my 401ks and went after it. The rubber is against the road at this point. But in doing that, I took no VC. Nobody owns my company or my application. No investors can tell me how to run it. I can be creative as I wish. And that's why this business plan is going to work, because it's all referral based and motivated driven.
And I like what you said there about time in Bruce Lee's comment, because time is the one thing you can't get back. Even if you have all the money in the world, you can't make yourself have more time.
That's right.
So you do not want to be wasting your life on something you hate and don't have a passion for. And I'm so grateful that you did step out into a bigger vision to live bigger and to create your dream that will help so many.
Mm-hmm.
And what I like here at the client service managers is it allows you to kind of be your own business owner within the realms of helping HCXperience come to be.
Exactly. It's like, I mean, sometimes I just sit there and I feel that I'm really tickled with what I've done here, because, and not to pat myself on the back, but what we've done is we developed an application and a business plan that has nothing in mind but the greater good of not only our planet, but of all people. Everybody involved will benefit and profit. It's really kind of cool. And some folk, I did a demo some time ago, and somebody said to me, well, at least I'll know you when you're a billionaire, Wayne. And I said to him, I know this thing will be a success, and that's what I told him. And I said, and I know the money will come, but it's never been about money. And that's why I feel that this business plan where everybody benefits, and I believe I'm a pretty fair guy, and I'm very easygoing, and I believe we're going to have a lot of fun with this thing. And my C-suite officers are of the same kindred spirit. It's going to be a blast. I have built-in incentives for my CSRs and CSMs at a corporate level, but not only that, as a CEO. How many companies do you know that you work for where a CEO will gift you for doing a good job? Not the company itself, but a CEO. If I have a CSR or a CSM that sells 250 licenses, I'm going to buy that CSR or a CSM an iPad. Not only is it a gift to them, but it will also offer them the opportunity to do their job better by providing the iPad. If that same person sells 500 locations or 500 licenses, I'm going to buy that person a Segway, because I dig Segways and I want to cruise around with my partners on Segways. So it's not only incentive driven corporately, because there is financial incentives built into that as well, but I myself as a CEO, I'm also going to be generous in our offerings as well. It's going to be a great time.
I love it. I know a great many people out there are really kind of leery about affiliate marketing and sales and all that jazz. But what I liked about your setup with the CSM and CSRs is there's no backhanded like, oh, if you sell this many but you don't get 10 people next month, then you lose 10%, or, just all these little loopholes and stuff that makes it feel really, really icky.
Yeah.
You know what I'm saying?
Oh, absolutely.
Yeah, and I love that it's just one price. Hey, if you're a CSM, you get 20% on a sale, and if you're a CSR, which is just a sales rep, and you do a sale, you get 10%, and you get 10% as long as that contract is active. So you've closed the sale, and bam, you're done. Right. But the CSMs are still going out there and keeping the client relationship going, and it's great to know as you said, it's also $2,500 for a license, so you know at the end of the day what you're going to get. There's no play here that, oh, if I don't get 10 people to follow me, whatever you call it, then I lose. Yeah.
That's right. It's really cool. One thing that I didn't mention, or did I? I don't know if I did earlier in our conversation or not, but even our clients have the opportunity to do referrals. So if a client hospital refers 25 locations, we give a $100 referral to anybody, not just CSMs or CSRs. If you have your doctor's office and you would like them to consider this, and if they contact us and sign on, whoever referred that client to us will receive $100. But also this manner, I didn't build a pyramid scheme. What I've determined is I'm going to allow our CSRs and CSMs to build not only our network, but theirs. So let's say I have a CSR in Texas, and that's my only contact. They now have the opportunity to refer their colleagues to do CSM and CSR duties in that region. And then in doing so, they would receive 2% sales of all their referred CSR or CSM. So they could build their own little regional team of CSRs. It's kind of neat. I just believe in doing it in this manner. Everybody will profit. We don't have anybody looking over our shoulders, and we're going to be able to build, and I believe very quickly, we're going to build the largest, most valuable real-time database our industry has ever seen.
Awesome. And I love the win-win aspect for both the patients, the doctors, and anyone helping you grow the company. And what's great about the idea of doing it this way is that why should a company do everything on its shoulders when you can come together as a community and build a great product together?
I know, man. It's really, I got to watch my slang. Like I said, Christina, I'm getting to know you. We've been on the phone quite some time now, so I'll try to keep the dudes and the diggets and stuff to a minimum. But I believe the same thing. Community is everything. I'm building a team. It's not a company. We're a team. And unfortunately, in the big picture, the big corporate scheme of things, many of the most important folks in big corporate America are those folks that are in contact face-to-face or your primary contact with your clients, and the folks, everybody in the middle to the top, are so far removed from what the client is saying and their concerns that they don't hear it and don't take action on it. With our business plan and our CSMs and our CSRs, it's an open door policy. Everybody's first name basis here. Nobody plays a larger role than the other, myself included. So if a client is not happy, that CSR or that CSM better contact myself or Dana and let us know, and we're going to make that client happy. Not get back to the client next week with an estimated time of completion on their troubled ticket. That communication will go directly to our programmer if there's an error or a bug or something that needs fixed, and it will be fixed. It's time to get back to
customer care, quality customer care.
That's right.
Love it. Love it. Before we end here, I'd love if you could tell the audience exactly how they can get in contact with you. Any offices out there, doctor's offices, medical hospitals that want to get in contact with you, and also anyone who would like to become a client service manager or client service representative, how might they get in contact with you?
Christina, yeah, absolutely. You can go to our webpage. It's HCXpinc.com. You can put the HTTPS in front of it, but you should get to the same place. It's a secure webpage. My contact, there's a contact tab there. You can contact us. My phone number is in the lower left-hand corner. I would love to hear from you. Like I said, my motivation is to let's get this thing started. We're going to be ready to roll next week. I believe our product is something special. And CSM, CSRs, if you're healthcare colleagues, I certainly would like to talk to you. If you're physician offices or even any type of care provider. You know, Christina, when building this application, we've even built in the idea that we can offer this to veterinarian offices.
Awesome.
Yeah, so and the product itself is a full service application. Patient, doctor, nurse, employee. So the survey engine itself can be used internally for more than just patient satisfaction. So I look forward to any communication or any conversation. You can also contact me on LinkedIn.
Awesome. I know we mentioned prior to the interview that you do plan to have this service run through many different applications, as you said, not just serving the health industry, but possibly in the future serving other industries where they could have quality customer care and surveys for their clients.
Yeah, it's funny you mentioned that. As I go to these conferences and meetings, you meet so many people, and We already have a couple folks. In fact, my lawyer who's done all the work for me behind the scenes on this product is interested in rebranding this for law.
Mhm.
He says that I forget what group he's involved with, but like 400 lawyer offices that still use a paper survey. And I've already been approached by a group that wants to do it for high-end restaurants. I believe this application we created has many verticals, and I'll listen to those offers, but
Mhm.
my motivation is to improve patient care. And if we look into those other verticals, it will certainly be a handshake agreement, and I won't, I did this so that I can have time with my family. And
Mm.
I believe the healthcare aspect of it is going to be very successful. It's going to offer that time that everybody is missing with their family to everybody involved at the corporate level, CSM or CSR level. So yes, there are many verticals out there that I believe this particular search or survey engine would be great for. And if you desire to talk to me about that as well, I'll certainly listen, but not until I've cured this disease in healthcare known as paper and IBR surveys.
Ah, thank you very much. Well, do you have any last words of advice for our listeners before we close up today?
Like I shared earlier, man, don't waste time. Life is so short, as I was terribly reminded that day when I had that minor stroke. And at that point, I sat on this vision for probably 6 years. It was at that point I decided that I can't sit anywhere. So if you have an idea, it's just time to live life, folks. Don't be afraid of the unknown. Too many times in healthcare, that's why technology in healthcare is so far behind, because it's the fear of the unknown. Well, if we do this, they might be able to hack this, or they might be able to get this information. But truth be told, Christina, there's more identity theft over the counter transactions than there is digital.
Mm-hmm.
So the fear of the unknown is what's holding healthcare back, and probably many individuals.
Agreed. And holding us back in all areas of our lives. Life, as you said prior with Bruce Lee's comment, is short. We only have so much time, and you should live your greatest passion.
Yeah.
Give back to the world, because that's what you're doing here. You're giving back and making life better.
That's exactly right. And I'm hoping to take as many folks with me as possible. So we're going to have a big party with this thing, and it's going to be a lot of fun. I really look forward to what the rest of 2013 has in store.
Well, thank you so much, Wayne. I'm so excited that you came on Savvy Central Radio today to share HCXperience Inc. And guys, please go to his website, HCXpinc.com. Thank you so much, Wayne. Have a wonderful, wonderful day.
Hey, same to you, Christina. It's been a blast. I'll talk to you soon.
Our sponsor for this episode is Winty. Winty is an aviation-themed t-shirt business designing and printing aviation-related graphics for pilots, aviation businesses, and aviation enthusiasts worldwide. Using DTG, direct-to-garment printing technology, Winty can print 1 or 100+ garments upon request within a reasonably low turnaround time, including customer-submitted graphics. Contact Winty Aviation T-Shirt Art by visiting winty.com today in order to find out how a custom aviation graphic can be printed for you. Join us this Monday, March 25th at 1 p.m. Eastern, where our guest will be Emily Walsh of The Firm, firmdirect.com, the #1 fitness program in the United States.